And we are starting the Instagram live. I think I'm starting an Instagram live. I'm not really sure what's happening, but we're going to find out. Okay.
Yep, this is streaming on live.
All right, and then we're going to hit the record button. All right, welcome everybody. Thank you for coming. As you well know, there are people who show up a little bit late. Excuse the beautiful phone and the screen with me. I am attempting to do an Instagram live, but I don't know what I'm doing. If you've done this with me before, you know that I am not a tech guru. I'm just trying to figure it out. Today we have the very lovely Dr. Lynn McPherson, who is a pain management and electroacupuncture specialist who is joining us. I'm super happy that he had a moment in his busy saving warrior schedule to join us. And so if you guys will just give us a few more minutes, we'll get all the way started here. And I'll tell you a little bit about myself to just kind of help waste some of the time while we're waiting on other people or not. So my name is Dr. Tanisha Dandridge, and I am an acupuncturist, and I am the co-founder of blackacupuncturist.com. And this meet and greet that we're doing every Sunday is just basically so people can get an opportunity to learn a little bit more about Black acupuncturists and the fact that we are real. And today I thought it'd be really cool to get a chance to have some one-on-one time with someone who is a specialist. And Dr. McPherson is just that. He's a specialist. And if you see me, I got 3 machines going over here, and I'm trying to make sure that I see, maybe that I see what's happening on my page, although I seem to not be able to do that quite clearly. Y'all work with me. I added technology, and so it got hard. Aha! Usually I monitor the Facebook side of things on my phone, and so I can't figure out where the video is on Facebook. So if you're on Facebook, I may not be able to answer you, and I'm sorry in advance because I can't seem to figure out where it is. So I guess folks will join us as they see fit. Dr. McPherson, take it away.
Hi, everyone. I'm Dr. Lynn McPherson. I'm currently a pain management specialist in orthopedics. It's great to be here. Thank you, Dr. Tanisha. As you know, it's been a little bit crazy in everyone's world due to COVID-19. So it's nice to kind of have this dialogue where we can emphasize holistic medicine and Black culture and our history that encompasses it, because usually it's forgotten. So I guess I can go into a little bit about how I got to where I am.
Yes, tell us a little bit about yourself, where you went to school, your practice, how long you've been practicing, what you got going on with yourself.
So my journey started, as I was saying before, is I used to do martial arts in Fort Lauderdale area. I'm actually born and raised, well, born overseas in Germany, but settled down in Florida. Parents were Army. And my sensei, he had a colleague who was actually a Black acupuncturist, in which I found out he was one of the first to be one in Florida when licensing started. So graduated from USF, exercise physiology, and then I wanted a stepping stone to get into a higher medicine. So I decided to go into the military, Air Force, where I still serve. And from there, I was actually exposed, I was in the medical tech program. And after passing that and getting to like my residency, there was actually in Keesler Air Force Base, Mississippi, there was an acupuncturist of Asian American descent who was actually doing acupuncture for the military, and he was booked. And everyone I talked to was just raving about him. He's like, oh, he's helping my depression, my knee pain. And I was able to kind of shadow him for a very quick bit because I was still a intern in medical training. So, you know, it's kind of everything's on lockdown. You have certain hours. And that's what kind of, you know, further enlightened one of the paths I wanted to take as far as being in the medical field. When I originally went into the Air Force, I went in as a reserve. So I didn't serve active duty. So because I wanted to be sure I was comfortable with the military, and usually you can go from reserves to active. So I was looking around and I realized there was a holistic medicine school in Florida that when I was working at a vitamin discount center, which is like a mom and pop's vitamin store, but you know, higher knowledge, because I actually got a lot of my holistic medical knowledge there from just studying books and higher trainings with actual research scientists from companies like Garden of Life, New Chapter. You know, we met the CEOs, talked with them. So I have a high level nutrition background also. So a customer told me about it, ended up researching the school, went there, loved it. It's known as East West College of Natural Medicine in Sarasota, Florida. Signed up, started taking classes in 2013, graduated in 2016 because it's a pretty much 3-year dual degree program. And so pretty much by the time I graduated, I was already licensed by the time I walked the stage. Because as you know, for Florida, we have 4 medical boards we have to pass: biomedical, acupuncture, oriental medicine, and herbology. And when I was going through, it was required to pass all 4, including herbology, what was the last one. So I've done herbology internships. Once I graduated, I was on military orders temporarily, and I just went to the wall academics with acupuncture. So I ended up going to a handful of trainings my first year being graduated: Dr. Tan's balance method for pain. I started doing more specialties in electroacupuncture and orthopedic acupuncture because of my sports and exercise science background. And then from there, I just started, training with some bigger names: Dr. Michael Corradino, neuropuncture, neuroscience-based acupuncture; Dr. Brad Wisnat, Master Tongue acupuncture. And Master Tongue has a serious history with pain management, but it's like very high level, very spiritual, but very practical, actually now very scientific, as they notice a lot of those points line up with various nerve structures and a certain neuroscience associated with it. I had my own practice in 2017 to end of 2018, because I was kind of balancing running a practice, working at another practice, and then military orders. Eventually, a colleague of mine told me about an integrative medicine clinic called Dedicated. It's under the umbrella of Chin Med, and they're actually started in South Florida by an Asian-based family, and they have about 5 clinics now in Tampa in which they specialize in Medicaid, Medicare, but they actually employ acupuncture physicians to help assist with pain management and other items within our scope of practice. So I was there from 2018 to 2019. And in 2019, I actually deployed to Afghanistan. And while in Afghanistan, I actually became, to my knowledge, with researching, because once I got credentialed, it was like because it was like unheard of. Because in the military world, a lot of the care is focused on allopathic medicine, and even the whole holistic care is focused on allopathic doctors, MD, DOs, advanced nurse practitioners, physical therapists can do acupuncture and dry needling. They don't really have acupuncture physicians. Acupuncture physicians in the Department of Defense world and VA world can be acupuncture physicians, but usually they're contracting. So when I deployed, we had a family health clinic in Bagram Air Force Base, and I went to my SGP, who was the Permanent Surgeon General of the hospital. I was like, I'm Staff Sergeant McPherson. I'm an acupuncture physician. I'm credentialed. I have no red flags on my licenses. I know my job is, medical patient transport. So anyone who was injured, we help them get into the hospital and then out of the hospital for military and joint military colleagues and affiliates. And so I was honest. I was like, hey, I know this is my main mission, but I have a tool that can help, our people stay, in theater, keep them healthy. I'm an acupuncture physician. Would you credential me to work in the hospital on behalf of Craig Joint Theater Hospital, which is named after a military member who passed, a medical member who unfortunately passed away, and the hospital was named after him in the early 2000s. The Surgeon General got with my leadership, and everyone was like, we believe in you. You have the credentialing. I gave them literally my entire resume with exercise science, physiology, and they're like, they pretty much blessed me. So I became, I believe, the first acupuncture physician who did not have to rely on a credential such as MD, DO, nurse practitioner, or PT to treat in a deployment setting using the full scope of acupuncture. To my knowledge, and no offense to the allopathic side, everything has its place, and those colleagues, I loved working with them because I was able to help a lot of military members with Bell's palsy, back pain, and other orthopedic issues while I was over deployed in Afghanistan. I closed my practice before I deployed, and now I'm currently serving 4 years active duty as medical readiness at MacDill Air Force Base, Tampa, Florida. And I still have my active acupuncture license, and I still do treatments here and there, and I still do research. Because of COVID, can't have been doing too many in-person classes. But ironically, I just finished Dr. Richard Nimzow's Battlefield acupuncture class. He actually offers that free to military members who are
Nice.
clinical. So I just finished that this past weekend and learned some great advanced battlefield acupuncture and other auricular therapy that I plan on utilizing. Hopefully, training with the person who brought it into the military setting will allow me to get some higher credentials at McDill and do some volunteer work.
That, honey, that is a heck of a CV that you just put down for us. Thank you for sharing, and thank you for making a way for other acupuncturists to be more active in the military bases and with vets, because it is nearly impossible to be able to work with them in spite of the fact that our medicine is so wonderful for pain management, for trauma, for PTSD, for just kind of everyday life. And it is an effective and cost-effective solution for being able to manage veterans once they come home, instead of just kind of not taking care of them as well as maybe we could. So thank you for paving that path for us.
My pleasure.
Telling us quite so much about you. All right. So is there anything in particular that you would like to share with us today? We can, delve in a little bit into Master Tongue. We can talk a little bit about eSTEM. I see somebody down there feverishly taking notes. This is your hour to just kind of describe more about pain management and eSTEM and your practice as it may be being a military service personnel.
So I think I'm gonna go over electroacupuncture. Electroacupuncture, it has research dating back to like the 1913s, 1920s, maybe a little bit further than that. But it was a tool that was kind of being utilized now by allopathic medicine. So a lot of the higher end trainees are using it because it has such a neuroscience principle to it. So how I got into it, I studied with two major groups, electroacupuncture medicine and then Dr. Corradino's neuropuncture, because I believe the current division we have in the world of allopathic medicine, which is Western medicine, and holistic medicine, whether it's Asian, Indian, is a discommunication and dialogue. Our terminology is completely different. And like a lot of my mentors have said, there's a time and place for our dialogue, because in the Western world, I can't enter an ER or family practice and talk about liver cheese stagnation and things such as that, because doctors are looking at us like you're talking, voodoo witchcraft, which is still kind of the mind frame nowadays, not as much. But if I go in there and I'm talking about, oh, okay, the patient has, neural inhibition, something's going on with the muscle, it's not firing correctly, or they're having some type of like inflammation response to like a prolonged injury, and I start talking about like neurotransmitters like mu, kappa, delta receptors and pain, opioids, it kind of starts piquing their interest, because a lot of people think Western medicine doctor, it's kind of weird now, because now it seems like a lot of people, due to the internet and social media, is doctors are bad, like especially Western doctors. So people are transitioning more into holistic, and it's unfortunate with our Western colleagues, because even in the military, we have about 22 suicides a day that we're still fighting. There's actually a high rate of suicide among doctors.
Yeah.
It's usually more of the emergency ICU, doctors who see a lot of trauma and they don't.
It's that burnout and that stress syndrome, which is unfortunate, because that is exactly what we talk about and what we treat with traditional Chinese medicine. We're always talking about the stress. We're always talking about the trauma. We're always talking about the ways in which it's been inlaid in the body. But because we don't speak Old Latin, we speak this flowery language that talks about stagnation and dampness and hearts and winds and all of these kinds of things. It seems like it's not the same language. And I point out to people, it's like, we didn't have language for the Sanjiao in Western medicine until we did. And then they found the interstitium. This is like, oh, this thing that's everywhere and nowhere and extends throughout the body. It was like, yeah, the thing we've been talking about for thousands of years in traditional Chinese medicine. So I'm hoping that with the more need for a non-pharmacological approach to pain, and with the more need for understanding that the general public wants a holistic method, wants a natural method of being able to take care of the body, and with understanding that there has to be a greater need for preventative medicine, which medicine kind of sucks at.
So,
we'll get a little more on board.
So it comes in with Western doctors, there's so much medical training you have. So I experienced it a little bit. You go through, you learn all this stuff. Actually, same with holistic medicine. You go through, you learn all this stuff, and then you get in the real world and you're just like, I learned this much, but only need this much. And you start realizing it is a lot of us, we're so kin to knowledge that we focus on the knowledge, not the patient. And so the story that hit me is I'm very technological. So I have all these apps and I can show you the bones, arteries, all this stuff, all these advanced apps. And so I found myself being in the habit of talking about what I know and what I can do versus listening to the patient. And one day, it was thankfully early in my career, I had a patient and I had my iPad ready. I knew it was back pain. I was going to show him herniated discs, all this stuff. And he came in and he kind of looked me in my eye and he's like, hey, you know, I've seen a bunch of back people. They're talking about surgery. He's like, I don't know anything. I know what's wrong with me. He's like, I just want to be able to pick up and play with my kids and not be in pain. And that's when it clicked with me. I'm like, all this stuff I know, like they already know. Most patients, if they've lived with chronic pain, with the internet, they've researched everything themselves. Sometimes they know more about it than their doctors or their specialists.
Mm-hmm.
And so sometimes it's just they need to be listened to. And then, you know, if you have a tool, it's just, you know, let them know, hey, I have this tool, I have this experience. Can't guarantee you anything, but I can help you. Like I can do everything I can to help you. And usually that's enough because in the medical world, whether Western or anyone, pretty much allopathic medicine is always looking for that guarantee, that black and white, where it's like, oh, either we can help you or you can't. And, you know, and it's usually relying on a lot on those pharmaceuticals. So that's why I kind of started learning electroacupuncture medicine or neuroscience base is, you know, getting back to the body has everything it needs to heal itself. It's just, you have to give it the proper tools and nutrition to do it. So once I started studying, like my favorite celebrity of all time and philosopher, Bruce Lee, you know, chop away and get rid of what's unnecessary. So, you know, I started learning all these different techniques and all these different things. And so the best part is when I started my practice, of course, it was slow. I was a one-person entrepreneur, you know, trying to do everything. I had steady flow of patients because the only insurance I took was Veteran Affairs Community Care. That was the only insurance I dealt with because I already knew about the insurance world and how much of a headache. And I believe in having access to care for everyone. But a lot of people, if you've never been a business owner, trying to do insurance and documentation and billing as a one-person show was very taxing. So I ended up just doing VA. So I was treating veterans because I came from that background. It was kind of a way for me to kind of pay it forward. And with a lot of the veterans, I was using the electroacupuncture medicine and neuropuncture, more so neuropuncture as I was along these lines. And I was getting great results with pain, opioid addiction. I had one person, we were treating pain and depression. And the most amazing thing that happened is he used to be one of those people go home, drink like 16 ounces of like, you know, malts liquor. And he's just so stressed from work. And he was actually a veteran and he worked as a contractor for the VA. So we started doing antidepressant protocols for relaxation and he started doing stuff for his pain. And he was like, I don't want to drink anymore. He's like, I come home, I find myself a little bit more happy. He's like, I'm not having like these darker thoughts. He's like, I'm not in pain anymore. And, you know, pain, a lot of people are now realizing, or what we've been realizing in the holistic world, but now they're realizing is, you know, pain can cause depression and depression can cause certain nociceptive pain or neurological pain. And it's a feedback loop in which, you know, we're so focused on the pain, we don't focus on the mental aspect of the depression. Yes. And so I think what's the
beautiful thing about this medicine, I love the fact that we can treat people and not just conditions.
Exactly. And so with that treating the whole person concept, the electroacupuncture medicine can address that, holistic medicine can address that, and it has its place. So I actually had patients where we were slowly weaning them off their pain medications, blood pressure, you know, safely. I always tell them, talk to your doctor, let them know. And I give them a copy of my notes. And so when I did my notes, it was also like a medical doctor writing it because I was used to being around the Air Force doctors. You know, I started learning proper medical documentation. So where I'll use my language, liver chi stagnation things, but I will also translate it, you know, pain due to, you know, herniated disc at this level causing this, this, and this. So I kind of wrote out the process. And so doctors would call me and they're like, do you have like a medical background? I'm like, yeah, yes, I do. I have emergency medicine, I have preventative medicine, and I have exercise and nutritional medicine. And so I started getting a little bit more referrals from the VA because patients were happy. And so the electroacupuncture, there's so many different ways, but the basis of it is it works on a neurological level. And pretty much the brain is the control center of everything, pain, movement, sensory. And so once you start tailoring your treatments and using specific frequencies, which are researched, so they research, you know, 2 hertz is great for endorphins. And endorphins is the body's natural morphine. So endo, so endorphins, internal, fins, morphine. So it's like a natural pain reliever. And what you start realizing as people is pain is a protective mechanism. And so once we have an injury that's prolonged or an inflammation process that's prolonged, our brain starts kind of down regulating our own internal morphine that kind of helps us, regulate the pain and allow that natural inflammation and recovery process to happen. And so that's what we start calling like nociceptive pain, kind of like that silent pain that happens that the brain doesn't respond to because it no longer knows how to respond to it.
Exactly. That signal has been cut off. And so acupuncture and then E-stem in particular can come in and help the body to start producing those neurotransmitters that it needs in order to recognize the injury and then to heal it.
So let me do a screen share of kind of. All right, so everyone should be able to see the screen. So I have like a photo gallery of acupuncture treatments I've done over like 3 years. I've had consent pretty much from everybody, but I'm trying to figure out one. So this is actually one of my favorite ones. The picture looks a little bit more intimidating, but trust me, this was painless. So this is where I was at ChinMed Dedicated, and a patient came in a day after they suspected a stroke. So working with the nurse practitioner who was that provider, they were like, she came to me the day it happened, but the patient couldn't get in. She's like, hey, I had a patient who had Bell's palsy. He already went to the ER, they ruled out stroke, but he's having like extreme facial droop. And she was like, can you assist? I was like, sure. Or is the patient coming in today? They're like, no, they can come in tomorrow. So they were there first thing in the morning, came with their wife. Their wife kind of broke everything down, told us, and he had like a significant facial droop. And so the mechanism of Bell's palsy is it's more of a viral infection that affects the facial nerve that crosses across the face. And so when that nerve gets infected, it causes a loss of tone. So it also mimics a stroke. So that's why you have to be important with ruling out, making sure a person doesn't have a stroke. So we ruled out, realized it was Bell's palsy, and it's myself and the nurse practitioner. And she was like, can you help? I was like, yes, I have a specific protocol from neuropuncture where we actually influence the nerves that are actually infected, the facial nerve and the trigeminal nerve. So this is a neuropuncture protocol where if you see the needle in the eyebrow, I'm affecting the supraorbital nerve. So that's the nerve that runs over the eye. I'm affecting the facial nerve, the trigeminal nerve, and I'm affecting the main root. If you see this one here by like the ear area. So the way the cranial nerve comes out, it comes out through that hole and it spreads across the face. So what I'm doing is I'm covering all the nerves of the face with 4 needles. Well, actually about 5, because I'm doing the
one underneath you too.
Yeah, the auricular nerve also, which covers the lower jaw. So pretty much with 5 needles, and I think I had one in the hand just for general vascular tone. I'm influencing the entire face. And so I'm running this at about 25 hertz microcurrent because research shows that's great for inflammation, and used with Bell's palsy, it's an inflammation case caused by a viral infection. And I believe within like 2 days after one treatment, he got about a little bit greater than 50% facial tone back.
Nice.
For one treatment. And then we continued the treatment until he got his tone back, and then he was pretty much fine after. I don't think I had an after picture, but that was like one of my better cases. And actually redid this treatment when I was overseas, if I can find it.
So those of you who have just joined us on Instagram, because I just figured out how to actually do this on Instagram. I thought I was doing it 15 minutes ago. The first half is recorded and will be posted some kind of a way to Instagram TV. Human body is amazing. And so I am watching in multiple places. If you guys put up a question, I will get to your question. If you have a question for Dr. McPherson, you can put your question in on Instagram. You can put your question in on Facebook. You can put your question in on the chat if you've joined us via Zoom. And I will do my best. Please work with me, especially if you're joining us on Instagram. Your girl is not technologically sound. So just bear with me while we get this done.
So I think I have it somewhere else in my personal phone, not synced yet. But so that's me in uniform. So this is one of the rooms I use. Well, I think the only room that I had open to use in the clinic. So this is actually our procedure room that we use for like small procedures. Like I had an ingrown toe due to my boot that I got removed in this room. So this is where I would be either before or after my shift started. So we were working 12-hour days. And so like I would go from a 12-hour shift straight into that room because I was especially working when I went from day shift to night shift. I would work from like 07 to 07, and then from like 07:30 to like a little bit under before noon. I was in there for like 3 or 4 hours. I would just treat people. So this was a Army member because the Betis Joyce, and he was like he was in support services, and of course he worked in the mail carrier room, so back pain, easy. And so this was the treatment I normally do with electroacupuncture, where I'm influencing the spinal segment. I believe we were working with L5. Actually, we were working a little bit higher with him, like L3, L2 area. I'm loosening up his QL muscle, which is kind of like one of those common back pain muscles that a lot of people have. And then I'm working with the transverse abdominal, which is one of the main muscles that allows us to keep inner thoracic pressure. So we have, we don't have we have even pressure, and we don't have any unnecessary pressure going to the low back to support our structure. So this is one of the different neuropuncture treatments with electroacupuncture. That's actually the device. If you can kind of see it in the cursor, and it has 2 micro and milli current, because research shows certain frequencies elect a certain effect. And so with neuropuncture or electroacupuncture, we have different ways in which we can influence, the mental state of like brain depression, and then the orthopedic state where balancing the muscles, because a lot of things are, muscle imbalances, motor points, trigger points. So I've done things where, you can take an acupuncture needle, use like one point if someone's having neck pain, and relieve the neck pain because it's either a trigger point or a motor point. And so as I've gone through everything in my course of being an acupuncturist since 2016, I found that electroacupuncture has its dominant place in the world that even Western doctors are trying to adopt now. So they have classes where it's about maybe 10% of our total training, because I know for my training, it was about 3,000 hours, 2,000 academic, and then 1,000 didactic clinical. So that's nothing against the Western doctors. That's just the training that's at their demand. Some of them are fine with it. Others, I've met great Western doctors who do nothing but acupuncture now and go through the process, and they have, great respect for the roots of acupuncture and where it can be and incorporating with their practice. And these are the doctors I find that aren't as stressed because they're taking care of their patients, and they're giving them a tool that, a lot of other people can't offer. I'm trying to figure out, show one more. I'm trying to figure out a video. I think this was, I think this was overseas. I think this was a scapular nerve impingement.
That looks delicious.
Yeah. So what happened is
this myself over there and get that treatment.
So this was a military member. He was so we have it was an Air Force, and so we had a group called Red Horse. So Red Horse were like the construction workers. Like if you need a building built, they're the ones. They put the building up, do all the electrical, everything, and then engineering would maintain it. So they were doing a lot of overhead movement and, trying to sleep. And I don't know if you've been in Afghanistan or a war zone, when you're trying to sleep and you hear like a bomb or something going off, or you hear like the machine defense system, people wake up, they're jerking. So next to back treatments, this was like my second one I was treating a lot, where I was just balancing the muscles, because as you can see, the scapular nerve comes from like C4, C5 area, and then it comes out a little bit to the trap, and then it runs down kind of like that space between your spine and your rhomboids or your shoulder blade. And so as you can see the movement, what I'm doing is I'm using 2 hertz, and I'm just kind of creating a better muscle tone to help that nerve entrapment free up. And so I have people who would just get up off the table and they're like, I can move, I can turn my neck. They were sleeping better as long as, we didn't have another motor strike. And that was all just from electroacupuncture. So I found myself using more electroacupuncture for like orthopedic versus like master tongue or traditional acupuncture for like distal, where we're using like hands, legs, feet. Sometimes I do combine them, especially if a person's like has severe neurodegeneration, where it just seems like they're stuck in a pain syndrome and it's not releasing even with like the local acupuncture.
E-stem definitely adds the icing and the cherry to the cake, I have found in my own practice, although I don't do as much of it locally on motor points and motor neurons and that kind of thing. I do a lot more of it distally to be able to help affect with trauma. So I'm looking more for the dopamine releases and the serotonin releases, which you can totally get from utilizing the back of the body and the spine. But I'm a particularly huge fan of doing as much as possible on stomach 36.
Oh yeah, everyone can use that.
Lots of research on good old fashioned stomach 36 for helping to build up the body and the red blood cells and the white blood cells and the platelets and the inflammation and the digestion and. Let
me see. You can kind of see it here. I'm trying to find a better picture. So whenever I do my distal, I do more of the master tongue, which is neurologically. So pretty much how the brain is how the brain, it's called like, so how the brain sees itself is big head, big lips, big hands, big feet. And the reason why is because as the nerves leave the body, as you start moving down the peripheral nervous system, which is like your arms and legs, the nerves start getting a lot more sensitive. So that's like the difference between, stubbing your toe versus like hitting your shoulder. It's like that nerve bundle. It's a lot more sensitive at our distal points. And so that's why when we do acupuncture on like the hands, the feet, the arms, we get such a powerful impact because the peripheral nervous system literally lights up the central nervous system, which is the main part of the brain, which governs, hormones and pain relieving. So like when we use Hagu Li4, it's as acupressure, we teach it for people with headaches. With acupuncture, we needle it for like a whole cascade of things. But on the Western level, if you look at Li4 or Hagu in this area, there's something called the superficial radial nerve. So the superficial radial nerve actually runs all the way up your arm, into your shoulder, into your neck, and it connects at C4, cervical spine 4. And so we can use those points for pain because let's say someone's having like lower back pain. I can use Li4 to influence it because with needling technique or E-stem, we're influencing cervical 4. And when you do that, any pain that comes at that level or below goes from like a scream to a whisper. And it also influences the periadductal gray, which is the pain control center of the body. And there's various points through research we've discovered influences the periodontal gray, and you can actually help dole out pain. I think Dr. Corradino, neuropuncture, he actually did it on himself, where he went in for like a dental procedure, and he showed us a video, and all he did was had E-stem on both hands, Li4, for like 20, 25 minutes, and he went through a full dental procedure. I think they were removing a tooth, so like cutting into the gum or anything, and he did it all without anesthesia.
That's nice.
Just by stimulating, and he has the video. He only shows it during the class. It's not like really out there, but he shows it to us. And I'm like, you went through a full dental procedure with no anesthesia. And he's like, yeah. just from E-stem. That's how powerful it is on the brain.
Make sure that you join us next week, because when we have Dr. Smalls, he has pictures of people getting like their chest cavity cracked open using just E-stem as anesthesia. And they found that people recover better when they're not having the anesthesia. They're able to get up, they're able to eat, they're able to function, and they don't have to go through detoxifying the chemicals that are used for pain management. So we will have some of those pictures next week if you guys join us next week.
Yeah.
Oh,
yeah. So it's funny you mentioned anesthesia. So I was in Scottsdale, Arizona. So with reserves, we have those 2 weeks out of the year you might hear advertised. And so I went to Scottsdale, Arizona because we have a military affiliation. And I was actually assisting with the anesthesia recovery area. We were just, I was just doing an internship. And it's kind of, I see why people are kind of nervous about surgery, especially with anesthesia. Anesthesia is very strong depending on what you get, what kind of surgery you get. And that's why it's very cognitive in the medical field to make sure you recover, because we've had patients where they've gotten anesthesia and then it takes them a little bit longer to wake up. And that's when you have that worry about that OD or the toxemia overload from the chemicals. And so that's kind of how acupuncture actually had its roots. Richard Nixon went over to China, or one of the, I think someone of his staff members had appendicitis and they did the entire procedure without anesthesia, just using acupuncture as the anesthesia. And that's kind of how it made its roots here. I believe it's been mainly in China from my own hearing, is, they still use it nowadays. Because
they actually do.
There's that fear of, they're putting someone on anesthesia and, they don't wake up or they don't recover as well as they should. So they use it, I know for my research, I think they've been using it more on like I've only seen like lower level, like gallbladder removal and things such as that. I'm not sure about cracking someone's chest and brain, but I know they have.
Not the brain. That there are pictures, there are videos. This stuff exists. We're going to see some of that next week, and there are definitely people who don't respond well to anesthesia. I'm one of them. When I had my cesarean with my son, I had a lot of complications. The anesthesia. I stopped breathing for about 24 hours. Like I couldn't really sleep for the first 24 hours after anesthesia because I would just quit. And it was the same thing when I had a tooth removed. I had a wisdom tooth removed. And for the first 24 hours after having what was essentially a local anesthesia, I didn't do so well and I didn't do so hot. So I will definitely be looking into some of my co-coordinators classes to see how to do some of my own local acupuncture anesthesia to survive these situations a lot better.
Yeah. So excuse the name dropping. I come from a martial arts background, so I believe in always paying respect. But Dr. Corradino, he was literally the reason I've been able to have a few of the opportunities. So when I was actually at Dedicated Chin Med, I did 2 presentations on acupuncture for doctors. And it was mainly utilizing the neuropuncture because he breaks it down into like 5 beautiful steps with 5 beautiful reactions with 5 interventions. And it pretty much explains acupuncture in its entirety, except for maybe more of the spiritual stuff. But we have things where like I'll do things local for depression using auricular and scalp points. But yeah, talking to him, and I've done his class I think 3 times because he also does cadavers also. So if you want to do like anatomy, physiology, and look at like cadaver specimens, if that's your thing, he's one of the top trained. But I know
it's on my to-do list.
Yeah,
I pay for the class every month, and I don't pay it as much attention as maybe I should.
It's hard with everything that's going on. It's kind of like people who read books. It's like you get another book before you finish your first one, and then it just keeps going. But I believe with everything that's going on in the world, especially with coronavirus, I know there's been an uptick in holistic medicine interventions for prevention. Coronavirus is a virus. It's a very deadly, potentially deadly respiratory virus, depending on your current state of your immune system, including like factors with like age, immune compromise, and things such as that. So I know a lot of acupuncturists have been doing things for preventative. And then there's actually been acupuncturists who've been doing things for recovery, kind of like we have protocols for cancer recovery and those who are undergoing chemotherapy. Haven't done any of the classes yet.
Hold on a second. I am paying attention to the questions, y'all. There is a question. The name. Oh, you mean I think he's asking about the teacher for electroacupuncture. And if that is the question meant to you, then the name of the teacher is Michael Corradino, and he does neuropuncture. And I'm not sure if you can join the class without a medical background, but you can look up neuropuncture.
No, I've done neuropuncture, and there's been chiropractor physicians who have who also are dual licensed.
Still a medical background though.
Yeah, so them in there, but yeah, everyone, you do have to be medically licensed. I believe he does have some courses himself. I'm not sure if he has like one separate for like public, those who are in the non-medical field. But you can always email him if you go to neuropuncture. I think it's neuropuncture.org.
All right. That was
if you want, I can take some time to answer questions.
Yeah, if anybody wants to jump on and ask Dr. McPherson any questions whatsoever, I'm going to check the chat over here. I'm looking at the chat on Instagram. I'm looking at the chat on Facebook, because otherwise we're just going to kind of roll along and allow Dr. McPherson to amaze us with his amazing brain. So if you have a question, if you want to jump on, there's only 2 people on the Zoom call. If you want to ask a question, go ahead and unmute yourself and jump on. If you want to type in a question, go ahead and do so, and we'll get those answered. Come on, note taker. You don't have a question down there? Yeah, you.
Okay, I'm unmuted. Hi, I'm Shonda.
Hi, very nice to meet you.
Nice to meet you too. I am a 4th year acupuncture student, and my background is in mental health.
Okay.
So I'm a licensed professional counselor in the DC area. And so I had questions about just your experience with like depression, anxiety with military, with vets, and how you go about treating them with PTSD.
Yeah, so I'm actually going to do a screen share, and I can actually show you part of a treatment that's pretty much a staple in neuropuncture. So this is kind of like the beginning of our antidepressant treatment. And so acupuncture since its beginning, we've been treating psycho-emotional issues. Originally based off the elements, but you'd be surprised how well people master elements, kind of like zodiacs. But this is kind of a general treatment that I used for anti-depression. And so if you can see my cursor, I have a point here, which is yin tong, which is, some known in some cultures as third eye. And then I have a scalp point, due 20 area. And so what I'm doing is, one of the principles of neuropuncture is creating electromagnetic fields on the head. So you might have heard that a lot of Western doctors are actually doing it. They're doing transcranial magnetic stimulation, where they put like a giant helmet on your head and they shock you on certain points of the scalp. It's kind of uncomfortable from what I've seen, but so what this is, it's a lot gentle. And so what we're doing is we're creating a natural small transcranial magnetic stimulation without the pain or discomfort, and we're regulating the frontal lobe. So in neuroscience, the frontal lobe is what governs our emotions and the cognition that comes with it: anger, depression, happiness. And so what depression is you can link it to a downregulation of dopamine and serotonin. And so what this treatment is, we're actually helping the brain create its own natural dopamine, more so dopamine receptors. We're stimulating these receptors so that they work better, because that's why a lot of people are, when they're on antidepressants or serotonin reuptake inhibitors, they're trying to decrease the things that are taken away from dopamine and serotonin. So we're doing it naturally by giving the receptors back their tone that we lose just from general stress, poor nutrition. And then I also combined it with different ear points using NADA. There's a NADA ear prescription for depression. And what I usually do is I'll do about 2 hertz or another specific frequency on yin tong, due 20, and shin men on both ears. And I have patients, it's not because of, the human brain is stubborn. It's not always a one treatment I get the results, but usually within 10 treatments or less, like, people are happier than what they were originally. And as you can see with the reforms and everything, or just everything in the last like 2 decades, there's a bigger emphasis on mental health.
Yes.
Because we've treated it poorly, not just us, everyone. Back in the day, if a woman wanted to, vote or work, they would throw you in an insane asylum. If people were like, hey, I don't feel well, I'm hearing things or stuff, insane asylum. And then as it started going is, people still frown on therapy. Like, I went to therapy, even though, I didn't have any major issues. At least I thought, after Afghanistan, after some of the things I see, it's still good to go to therapy and talk to someone. So I think you're going to do great, because, you're going to have a lot of tools that even us as acupuncture physicians don't. We don't have that experience with, how to talk to someone who has mental health issues and things. It's just, all we have is this tool where, we can do acupuncture, we can use nutrition, we can use herbology, and we're slowly, for those, when you do meet acupuncturists who do specialize in mental health disorders, they have great experience. They know how to talk to patients. Me, I know, like I said, you got to be careful what you say to certain mental health patients, because it's a very sensitive subject for some people, and you got to know how to approach a person. So I think it's going to work out great for you, because you already have that experience with specializing in mental health. And now you're going to have a physical tool you can use almost anywhere. Like, you can literally walk around with 5 needles in your pocket, and there's protocols you can do in the ear for depression.
Great.
That's why I actually love acupuncture, because it's so mobile. Like, there's been times I'm out and about, and if I visit like a family or a friend, they're like, hey, I have this kink in my neck or this. And, if they're like a good family or friend, don't have to worry about doing the whole waiver and all that stuff. I was like, hey, are you comfortable with me doing this? And they know my background. And I have like a needle or something. I have a sterile acupuncture needle on me. And I just do like 1 or 2 things, and, I reduce their pain. And I think that's what kind of differentiates us from medical doctors or allopathic medicine, is we have a physical tool we can use with, that doesn't cost a lot of money, doesn't cost a lot of time. Well, outside of our education, doesn't require a bunch of time, maintenance, or a lot of politics to use. And so I think you're going to do great once you graduate. So my thing is pass all your boards first.
Yes.
You can't get your license until you pass all your boards. So pass all your boards, and then don't fall for, the fear of your future. If you want to specialize in something, which is great, start following and studying the people who are, premiers or pioneers or experts in the fields you want to study. Because, I've done so many classes, I've done things on women's health and like things I know I no longer utilize, but I was exposed to it. But if you know what you want to do, I say go for it.
Okay, thank you. Thank
Welcome.
you so much. And yeah, and that's something that, well, and the reason why I'm an acupuncture student is because you talk about how we have the experience with like rapport building and
Yes.
and talking to people, and but there comes an end to that, which brought me to acupuncture. So there's only so far that goes, and with the physical acupuncture needle is what, and knowing how to use that. So there's an end to talk therapy, which is what brought me to acupuncture. So thank you so much for
More
that.
than welcome.
Excellent. Thank you for your questions, Mama Shonda. I am looking to see if there are any questions anywhere else, and it doesn't look like it. Mental health is definitely one of the things that I'm very passionate about, being known as the person who researches the effects of acupuncture on transgenerational trauma and racial battle fatigue, which is incredibly important right now in this time that we find ourselves in. So were there any other like really wonderful tips and tricks, things that you would like to leave to your everyday Dre, as I like to say, that they could do for themselves? Are there anything else that you would want to share with our audience? Because the time is kind of ticking down, and although we can go forever, you may not want to.
I'm just going to share one more screen regarding, so kind of like that whole thing. So this is actually a person we were working. He had a herniated disc, and what happened is it affected the level of like L5S1, and it caused him to have a drop foot. So like when he walked, his foot would drag, and so that was one of the things we were treating. And we knew it was drop foot because they do this thing called a nerve conduction study, where it's kind of like acupuncture, but they stick in like these big electrodes and they run current through it, and they see how well the nerve responds. And so part of his leg wasn't giving like a proper response, so the nerve wasn't like firing. And so we were doing acupuncture on this lower part to kind of bring it back. And he started getting some results, but we were drop foot when it comes to like a herniated disc that kind of, severs that nerve connection at the spine, takes a while. So we were treating him for a while, but he also, he was having issues with sleep. And so that's where it comes again to like that depression and relaxation. Yin Tong Do 20, Ir Shin Min, electroacupuncture. And then right here, he sleep. Like he fell asleep on my table within like 2-3 minutes after I left the room. And so those are like the powerful tools we have, because, I actually throw in this lot of treatment, and I tell people it's for relaxation, but it's mainly to kind of relax them and treat any underlying, I don't want to say depression, or I just want to say down-regulated mood. Because, a lot of people don't think about that when someone's in pain. Because if you're in pain, you're not happy. And if you're in chronic pain, you're way less than happy, and you're probably borderline depressed. And I think that's not being addressed in a lot of pain management clinics. And with Florida, or especially, so when I was at Dedicated, the state actually changed law where doctors could only give 7 days worth of opioids. If you needed greater than 7 days, you had to have a doctor you had rapport with, because what they found out is doctors were just giving people, 30-day supply of opioids, come back, oh, it's not working. Well, oh, you ran out here, and they're just doing it. A lot of doctors wanted to take people off, but they didn't have the political backing, because I think there was a law stating that you can't drop someone from pharmaceutical treatment without like a specific reason. So now doctors were happy, but we had a bunch of people upset. And then once, when you have people who can't take their pain meds and they're in pain, they're upset, they're mad. We now have acupuncture we can do. And that's why, it's great that it's becoming more mainstream with the powers that we have in acupuncture and all the modalities that we can do. As far as like things I like leave, I had it, I think it got deleted when I left Afghanistan. So I actually used to teach a portion of sleep with the mental behavioral health clinic, which was ran by the Army. I would teach once a week, and it was always like 3 or 4 people who kind of needed a break from like the war zone and things. And so if people had notepads and pens, one of the things I do, even for myself, is I do brainwave or sleep therapy. So my mind races a lot. And so you have different brain waves. You have alpha, beta, delta, theta, and gamma. Alpha is kind of like your alertness, your focus, kind of like hopefully some of us are, where we're alert, we're focused, we can talk, we can hold the conversation. You have beta and theta is when you're kind of like, slowing down, where like you're getting ready to go to bed end of the night. When you meditate, most people are in theta, where you're kind of aware, but it's like that lucidness, and it's great for like brain connectivity, neurotransmitters. And then you have like delta, which is like that deep sleep, that REM sleep. And so if you look up online, so if you're a person, your mind's constantly racing, you can look up things such as, beta and theta frequencies to go to sleep to. So YouTube is full, YouTube, Google, there's free downloads. So I usually look up beta and theta frequencies that I just play as I'm lying in bed. So that's trouble going to sleep. If you have trouble staying asleep, you can use like delta frequency sounds that you can play. And everyone has laptops or smartphones, so you can set like smart timers to turn them off. And I actually started getting a lot of feedback that people liked it, because not everyone's lack of sleep is different. Insomnia affects people in different ways, which also ties into pain management, because if you're not sleeping, you're not recovering, and then neurologically your brain's like on fire. It's like always racing, it's on edge, because it doesn't have time to kind of rest and clean up that gunk. Because when you sleep, that's when we start cleaning up a lot of that plaque that built up in our brain. And what they're realizing is people who have like Alzheimer's and dementia, they're not just linking it to like poor nutrition or genetics, they're linking it to a lack of sleep, because you have so much plaque building on the brain that we're not allowing the sleep mechanisms to help remove it or keep that decline, along with nutrition and things such as that. So that's kind of why I like to link with people, is look up the brain waves, and the brain waves will tell you what state of sleep, either going to sleep, staying to sleep. And you can actually look up the certain frequencies you can play online to help you with sleep, because like I said, sleep is very linked to pain. Because as I learned from Dr. Cordino, if we did sleep 7 to 8 hours a day like we're supposed to, that's 33% of our lifespan. And those 33% of that lifespan can influence the other 66%. So that's why I tell people, if you're not sleeping, acupuncture works great for that. And then, like I said, the different frequencies you can kind of do like as at home homework. But I know acupuncture, like I said, there's so many things, so many specialties, like it's hard to kind of fit it all into the hour. So it's great that, we have people who are interested, who are seeking it. And as far as being an ethnic acupuncturist, it's kind of rare in our world, like less than 1%. And so when I do meet colleagues, it's amazing to hear their stories, or it's amazing to like dedicated, since it's Medicaid, Medicare, all the clinics are in kind of lower income areas. I see, African American, they're just like, you're the doctor. I'm like, yeah, like, yeah. It's not the fact that I'm the Black doctor, which is just as rare. It's that I'm a Black holistic doctor who has, an allopathic medical background, and is kind of proud to kind of be kind of segue off into my own path, where I was accepted into a couple of MD schools, but after looking at how the system treats medical doctors, it's a shame. How the hospital systems, it's more politics than anything. It's being held hostage by insurances. And so a lot of doctors have good intentions. The doctors that don't have good intentions, you can tell, or doctors who are unhappy, you can definitely tell, because they're usually rude. But being a doctor is not as great as it used to be back in the day. And I heard that from a trauma surgeon with Dr. Cordino when we were doing the lab, because he's like, I'm a trauma surgeon because I love, doing surgery. But he's like, I don't do it for the money. He's like, I never had the time for it. He's like, I love it because I'm helping people. So I think it's kind of like anything, when you find something you love, it doesn't really feel like work. So even though I haven't had my active acupuncture practice for almost a year now, I still find ways to keep up my skill, because I like helping heal people, which is kind of rare in this world, to find people in the medical field who just generally want to help despite, everything that's going on. So I'm really proud to be a Black acupuncturist, and to have a tool that can not only just, help my friends, family, but it's a tool that can help the world. And I was actually exposed to that when I was in Afghanistan, able to help, members, who were just not doing so well in the war zone capability, and just, the battle that we're having here in our home soil with the reform, Black Lives Matters, and things such as that.
Well, I agree with you wholeheartedly. I became an acupuncturist with my own health problems. I had to put myself on mute. I have interesting neighbors. There's this one neighbor that walks by like every day at this time with a giant speaker on a doily.
Old school. Is he playing 8-track when he passes by?
No, he's playing Run DMC right now.
Oh, okay.
Or something. I don't know what it is. Like he plays this old school music every day. So yes, in light of 8 minutes and 46 seconds and George Floyd and the social political climate that we find ourselves in, Acu-Points, Black Acupuncture Meet and Greet was really, really important. My work is in, again, researching the way that acupuncture can be used to help combat some of the racial battle fatigue, which includes things like problems with sleeping, which includes things like downregulation of mood, which includes things like an imbalance in the body because it's always in sympathetic mode and it's never in parasympathetic mode. It's never in rest and digest. And so all of this allostatic out of balanceness is kind of perpetual and the body never gets a chance to repair. And so I did a talk a little while ago and there was this one Black student who was just like, I've never seen another Black acupuncturist. And according to the 2013 NCCOM survey, we're like 1.2% of the total acupuncture population. So it is important that people see us. It is important that people know that we're out here. And it is important to know that we have people like you who are specialists and that it doesn't have to always be 5-element because that's a lot of what people get exposed to. They get exposed to just the 5-element aspect of it. They don't get exposed to things like neuropuncture. Next week we have Dr. Tolbert Smalls, one of the grandfathers of acupuncture coming up. And then the week after that, we have Lorena White, and she is all about womb health and womb care, which is another aspect of medicine to be addressed with people of color. And, I tell folks, particularly when it comes to womb health, it's just like, oh, just eat better and be a raw foodist. And it's just like, no, how about your womb can't be okay if you can't have hormones, and you can't have hormones if your body's always thinking that it's running away from a grizzly bear that it can neither find, fight, or hide from. So I just wanted the world to be able to see like some of the magnificent people that we have that are Black acupuncturists. And there are a number of ways that one can go about bringing about holistic wellness and holistic change. So I see that we have 6 people on Instagram and a couple of people on Facebook Live. We're coming down to the bottom of our hour. If anybody wanted to hop on and type in a question or ask a question, now would be the time. We've been enjoying this last hour with the wonderful Dr. Lynn McPherson, who is a pain management specialist and an electroacupuncture specialist. Not all acupuncturists do electroacupuncture medicine, and he knows infinitely more about this subject than just about anybody I know, which is why he was invited to come on here and join us today. So I'm seeing all the hearts go up. Yay, I'm really glad that you guys have been enjoying the hour. I'm sorry, Instagram, that the first 15 minutes are missing, but I'll post them. And if there was like a tip or a trick besides learning how to do the different brain waves that people can look up on YouTube and even on Spotify, if you have Spotify and or you can look up the brainwave music. Is there anything else that you would want to leave our guests with tonight that they can do for themselves in order to help bring about their own wellness?
One of the things I've been incorporating for myself, because I do a lot of home-based workouts now since I built my home gym and I don't really trust commercial gyms. I believe in exercise. Exercise is pretty much one of the number one things in research for antidepressant pain. There's like a whole neural cascade that goes with like glutamate receptors, the dopamine, serotonin. So one of the things that's actually underutilized is mobility. So I would employ everyone to start looking up mobility exercises. There's mobility WOD. There's like a whole thing. So if you start looking up like functional range conditioning, functional range assessment, start working on your mobility. Just get up and move. A lot of us are sitting down sedentary. That quarantine 15 is getting some of us. But
Guilty.
I believe in like movement. So I'm an avid believer of mobility. Just as we age, if you don't use it, you lose it. So like if I did like this and rotated my shoulder completely, not many people do that in an entire 24 hours, and so your body starts getting stuck and kind of like the planes of motion that you use every day. So sometimes I'm sitting here and I'm just like rotating my wrists, just doing things just to kind of keep my joints healthy. So I tell people, if you have like a space on the floor, yoga mat, something, TVs, iPads, you have all these devices. Just start looking up different mobility exercises that you can use for yourself, because that's the part of like orthopedic acupuncture, electroacupuncture that I've been working on, is getting people to do stuff at home. Like, hey, you just need to move. And you've probably seen the commercials, Just Move, for like those who have arthritis, where they're like dancing in the supermarket and stuff, because we don't move a lot. We don't move like our ancestors do with, not really like, I mean, I'm not going to go back to like hunter gathering days, but we were a lot more active before technology and everything else. So I tell people to start looking up mobility exercises, or you'll start coming along the terminology PALS, RALS, but like just look up mobility exercises for home, and you'll be amazed, just 10 minutes a day of maintenance, what it can do for the human body, back pain, neck pain, shoulder pain. And so that's kind of like another tip I like to leave people: start increasing their mobility, not flexibility, mobility. Flexibility is just, how, can you do a split? Can you have like, it's pretty much like your range of motion. Now, how much of that range of motion do you own? How much can you do when you have to move a joint through its full range of motion that is allowed? So that's why I start kind of, preaching now to a lot of my patients and colleagues.
All right, definitely increase range of motion. Excuse me, not range of motion. Well, you should increase your range of motion too, but definitely increasing mobility. I tell people, like, having an active lifestyle is more important than like having that one concentrated hour at the gym. And then I see a question on here, and the difference between 5 elements and neuropuncture. So in traditional Chinese medicine, it's very much like cooking, is how I like to explain it. And cooking, you can have Spanish food, which is different from Italian food, which is different from the whole world of Asian foods, which is, you have Thai food and Vietnamese food and Korean food and Szechuan food and Mongolian food, which is different from food from Nigeria, and food from Ghana, and food from South Africa, and food from Zimbabwe is different from food from Australia. They're just recipes. And so in traditional Chinese medicine, there are a variety of different traditions that come along with traditional Chinese medicine. And so neuropuncture is one style of acupuncture that happens to include electroacupuncture medicine. So those were some of the wonderful pictures that we saw earlier. I'm coming. I see these questions coming up, y'all. So
I got time, but so like, oh,
I got time.
One thing I actually forgot, my background, my last year at acupuncture school, I actually went to the Shaolin Temple, and actually I studied with the monks. And just so people don't think.
You find your pictures. And so 5 element is one style of acupuncture. It is a little more esoteric and spiritual based, and neuropuncture is a little bit more in alignment with kind of Western medicine and how we understand the body from a Western medicine practitioner. Ooh, I'm going to fix that Instagram. Hold up. There we go. So that is Dr. McPherson right there. Where'd it go?
Oh, sorry about that. No, that one's a little bit too blurry. Let's go back to this one.
And so acupuncture helps with inflammation in a variety of ways, but the most important part of that inflammation, I have no idea why this man keeps emailing me. It's really disturbing. One of the most important ways that acupuncture helps with inflammation is that it breaks up the cascade of chemicals that lead to inflammation in the first place. And it tells your brain to go in and fix the problem as opposed to ignoring the problem. But we have, again, the wonderful Dr. Lynn McPherson here, and I'll let him use his neuropuncture terminology to explain how acupuncture helps out with inflammation, in addition to telling us the story behind this picture.
So in 2016, I had a colleague who I actually was, when I was first exposed to martial arts back in 2000, before I graduated high school, and he actually worked a long distance program. So the Shaolin Temple actually is open to international students, the one I went to, for martial arts training. And what he did is he was working with the coordinator to create a training specific for those who were in acupuncture school. And so when we went here, we did about a 200-hour course in Tai Chi, Qigong, martial arts, and acupuncture directly from the Shaolin monks in China. And I'm trying to figure out where's one of our acupuncture sessions that we did. I think it's right. Yeah. So this is the head monk of Shaolin, of the Shaolin Medical Temple. And he was actually doing acupuncture on my colleague here for his shoulder pain. And so we were getting like firsthand knowledge and exposure to how they do it. They're a little bit more heavy-handed, but I mean, it's like great results. And like I said, these are all points we use in like traditional Chinese acupuncture. And so with the neuropuncture style, like Dr. Tanisha was saying, the 5 element style, that was born out of the elements. So remember, this is like back in like the dynasties, there was no MRIs, there was no x-rays. It was just the elements. And what they started noticing is certain elements started having certain attributes with humans, and then they started matching those attributes with like certain physiological functions. It's not 100%, but it is very close. So if you think of kidney is the water element. And so when you start thinking of the kidney, and one of the attributes of kidney is fear. And so, when we're kids, if you get really scared, someone wets themselves. And they attributed that attribute just by looking at like the water, the streams, and like how fluids and everything move in the human body. And they figured out so much accurate items with no technology. And it's still, becoming aware today. Like we just, Western medicine just figured out the lungs actually assist in making blood. Chinese medicine has been talking about that for thousands of years. It's just now they have cognitive and definitive evidence that the lungs actually help produce byproducts that actually increases blood volume and create new blood. So in neuropuncture, ours is based off of, let me see if I have it somewhere. So it's based off of 5 principles of where, so I'll talk about like the first 1 or 2 principles, because if I talk about all 5, it'll open up a whole cascade. So like the first principle is local. So locally, when I do acupuncture local, there's like a whole chemical cascade that happens that Dr. Tanisha was talking about. So when I put in a needle, I'm creating kind of like a controlled trauma. And so when we do acupuncture, we have a chemical soup, Dr. Corradino calls it, that gets started. We have calcitonin gene-related peptide. Say that 5 times fast. Calcitonin gene-related peptide is the most powerful internal nitric oxide producer of the human body. And so what this does is it actually creates oxygen, increases oxygen utilization for where wounds or trauma is, because you need oxygen to kind of speed up that recovery. You have nerve growth factor that helps with assisting like nerve inflammation. You have glutamine that helps with the body's natural amino acid as far as like natural recovery. So that's what happens at a local level, is all these different chemicals start getting utilized. If we talk about like the spinal segment, like I was talking about with LI4, if I stimulate this point here with the acupuncture, or even like a uncomfortable amount of pressure, I'm stimulating the superficial radial nerve, which runs all the way up your arm into your cranial nerve 4, which goes into the central nervous system of your brain, which goes to the control center called the periadductal gray. So I can influence whole body pain with just 1 point because of the way the nerve runs. And so a lot of our important acupuncture points, that's how they work, is we're stimulating these nerve bundles that run to these different segments of the spine that have like these different regions of the brain that you can stimulate. So that's like the second mechanism. So first mechanism is local. Second mechanism is specific nerve, which goes into the third mechanism, which is the spine. So at the spine, for and like I said, this is just how neuropuncture explains acupuncture. I mean, pretty much everyone has a spine. So at the spine, you have a dorsal horn, and the horn is where the nerves run in from like your arms and legs. And so when we're stimulating this point, Hagu, it runs up and hits the spinal, the dorsal nerve of C4. And at that horn, you have something that gets secreted. You have adrenaline, noradrenaline, and serotonin get secreted. And, serotonin is a great big anti-inflammatory and pain relief. Adrenaline and noradrenaline are kind of like natural pain relief also. And so they get stimulated directly at the spine, even though I'm using a point on your hand. And so when you stimulate those points, you get great anti-inflammatory and increase in nitric oxide, and it goes directly into the brain to kind of influence that area. So those are just like the first 3 of the 5 mechanisms, but that's how we explain it in neuropuncture. Notice I didn't talk about chi, I didn't talk about, elements, I didn't talk about, more of the spiritual stuff. This is what science has proved when I use acupuncture at specific points. So like another point is stomach 36. It's actually a point on like your shin. Research has shown that that point by itself can stimulate the entire immune system to help upregulate it. So it actually increases your immunity. And they've actually done the study. I don't think they've done it on humans yet, but they did the study on rats, and they actually did the same stomach 36 area on rats, and they actually helped reverse sepsis. It was done at it was done at Rutgers University, and it's documented that they've used this point to kind of help, rats that had septicemia, which is a sepsis is when an infection reaches your blood. That means it can travel anywhere. They use stomach 36 to help reverse that. And so there's different neurosciences to explain how acupuncture versus chi, meridians, and things such as that. When you start doing the comparative, you start noticing that how the meridians were drawn for acupuncture, how they map a lot of the major nerves in the body. So yeah, so that's going to be so like I was talking about before, the main difference is terminology, because there's a lot of things we talk about with 5-element terminology that kind of correspond to Western medical terminology and knowledge. It's just we're now having more pioneers or more people bridge those terms and figure out those small gray areas that kind of, we utilize as acupuncturists that kind of give our patients greater care, because we have to know our history and our terminology along with how it translates to Western, because, there's certain treatments I wouldn't do because, someone might have like a certain contraindication. So hopefully that answered your question.
Yay, that was a wonderful question. All right, so Facebook, I have just figured out that there are lots of questions happening there and I've been missing them. So we're going to backtrack to some of those. One of the questions that we have from beautiful Jill at Breathing Space was, what seems to have been the turning point for the VA medical staff to be open to neuroscience-based practices with acupuncture?
So that actually came, so like I was saying, literally this morning and yesterday, Dr. Nimzow, so Dr. Richard Nimzow is a retired colonel with the United States Air Force, and he was actually one of the first people to start incorporating acupuncture within the Department of Defense, and which translated to the VA. So he was, like I said, I just found all this out, and he was like, he has great experience, even though he's not classically trained, but he actually did a lot of training on his own to incorporate acupuncture. So he was 45 years of medical experience. He is a classically trained radiologist oncologist. So that's what he did. And then he started using the battlefield acupuncture, which is kind of like a specialized ear prescription. So he was one of the pioneers to bring it in. And then there's, trying not to get political about this, there's a group, I forgot their name, they're in California. And it's the training group for the medical doctors, the 300-hour course.
Don't make me lie to you. There's too many groups. I can't remember.
I don't think it's not Kaiser. It's so there's like a group in California that's kind of like the predominant training of medical doctors, MD, PAs, DOs, and medical acupuncture. And so they're kind of been like the main organization that's been kind of working with the DOD and the VA with certifying doctors with acupuncture. So pretty much if you're working for the Department of Defense of VA, you have to go through this group in order to be licensed to practice acupuncture with the DOD VA. Unfortunately, the political battle is they should have been hiring acupuncturists, but we have so much division in our organization because we have about like we have the NCCAOM, which just certifies us, but we have American Society of Acupuncturists. There's like 2 or 3 other major groups, so we don't have that.
CSOMA, and none of those count in California. It has to be the California.
So like, they have the American Medical Association, AMA. It's like if you're a medical doctor or a medical professional, like a higher credential, you're part of the AMA, and they represent you, your scope of practice, and everything. And so we don't have that scope of practice because all our states even aren't on one unison with licensing. With AMA, if you go to a state, you know exactly what you need to do for a medical license. For us, for an acupuncture license, it's not universal, which causes a lot of obstacles. And so the DOD and the VA, mainly the DOD, they rely on medical doctors, nurse practitioners, PTs doing dry needling, which is just a form of acupuncture. The VA actually is more open to hiring acupuncturists, but they prefer those who, I think they're moving towards a master's level and a doctorate level. So when you work for the VA or federal, you work as a GS position. And so when you're like a GS9, it's really not that great as far as pay compared to the work or the benefits. So what happened is the VA actually, I think when you were a master's level acupuncturist, you were like a GS 11 or 12, which is kind of like a very high level for, being in that field. And I guess the predominant group ended up influencing the VA, and they dropped a lot of the GS positions for acupuncture physicians down about 2 or 3 levels. And it made a lot of people, like it was like a big income hit with like benefits. So so the VA is still, so because of late in Obama and early Trump with the VA reform, they want more holistic. It was because of the opioid epidemic. So
and
because of
the law
opioid
change that
epidemic,
happened in 2018, where you had to have a non-pharmacological approach to pain. They
yeah.
had
So when that got voted in, because I think Obama was working on it, and then Trump kind of solidified it, that we were supposed to offer, that the military and DOD and VA had to offer non-opioid interventions. And that's when there was kind of like an ramp with hiring acupuncturists back into the DOD. So like I had a colleague, he actually did it for the Army Special Operations, I think in Virginia. And even then he was only like a GS9, GS10. He went to the VA, I think he got his doctorate, but his doctorate put him at like a GS12 or GS10 or 11, still not that high for having a doctorate level in natural medicine. But that's why they had the VA community care, because a lot of people are trying to get and see acupuncturists, and instead of them hiring more, they just kind of outsource it, which works out great for those who do know how to navigate community care and insurance. But that's been kind of the pivoting point with holistic medicine, specifically acupuncture, with within the DOD and VA.
All right. Well, our Instagram live just died, but I wanted to make sure that we got to Mama Aaliyah down there. She says, what is your best advice for those pursuing acupuncture? And we'll make that the last of our questions.
My best advice is find a school that's one credentialed, because that's been a thing. That's been an issue, is a lot of schools are losing their credentialing because they don't have the leadership or the program. So I would say find a good credentialed school. Make sure you go in with like intent and focus. Know that you're going to learn a lot, and you're only going to use so much when you get into the real world. And also make sure that you stay in touch with your mentors or those who are legit, because you might find a lot of teachers who are good at teaching, but they're not good at acupuncture. And sometimes vice versa. You might find those who are they're very good acupuncturists. They're great business people. Because I'm gonna let you know now, when you get into the acupuncture physician world, either you're gonna be working for yourself, working for someone, working with someone, if you form your own practice, or you're gonna be forming your own practice. But either way, you need to have a good business sense, because at the end of the day, medicine is a business. It's just we're providing a better tool. We're getting people get more bang for their buck with holistic medicine, based on like your training and your experience. So when you go in, find a credential school, make great connections, stay in touch with people, figure out what you want to do early. If you want to specialize in women's health, they make lucrative money, but they also help, especially with like fertility, women's health things. So I'll tell you, women's health is like the things you can do with helping women with like menopause, fibroids,
and menstrual cycles,
it's
preterm labor, low-term birth weight, like dysmenorrhea, amenorrhea, what do you got?
Endometriosis.
Endometriosis, fibroids.
Biggest things. I was actually going to look into becoming specializing in that, because I've had female colleagues and friends who just like that's like I wouldn't wish that on anyone. Just the complications, the pain. So that would be my advice. Find a credential school, great networking, find something you want to specialize in, find your passion early, and make sure you pass all your medical boards before anything. And make sure you get all your stuff, business-wise straightened, your resume, your credit, all that stuff, because those are things people don't think about, because like I said, in the acupuncture physician world, you don't think you're going to come out working for a hospital system. Even I know California is a little bit better because y'all have Kaiser.
We have Kaiser, but Kaiser is not the business. Sutter is actually a better system to be hooked up with. I know of several people who work with the Sutter system, and they have a lot more leeway to be real practitioners in the Sutter system. Kaiser seems to be a little bit more restrictive and just treat pain locally, and you get like 4 visits and then that's it. kind of thing. So
way better than Florida.
California, right?
Florida
With California, the cool thing with California is that we are considered primary care providers. And so that gives us a lot of leg room and a lot of leeway when it comes to working with hospital systems, integrative medical systems, and then being your own standalone practice. Having that title, that space of being considered a primary care provider is super important. If I was going to add on to anything, to all the wonderful things that Dr. Lynn McPherson just said, as far as like, what do you think? A lot of courses have student discounts too if you find your niche early. That is true. There are a lot of discounts. Advantage of the discounts, let me tell you.
When I was looking into functional medicine, I took Apex Energetics. Like their courses are like $800 and I was taking it for like $100. And this is like, so this is actually how I got it started a little bit. My neuroscience is because they had a thing called Mastering the Brain. And I still have it's like a Bible of a binder. And they talk about all the deficiencies that happen, all the neurological, common neurological deficiencies. They talk about all the nutritional interventions and different things. And I started using that to tailor for my treatments. And so, yeah, student discounts, but also find a good state you want to practice in. And it all becomes, like Dr. Nisha was saying, your scope of practice. In Florida, I have a great scope because I actually can do injections also with additional training. Thanks. But depending on what state you want to go to, look up their scope of practice, because you'll find some states don't have a board of acupuncture. You find some states that have where you only need like 1 or 2 medical boards, but you know, your scope of practice is very gray. Either it's very little, it's very large, or it's very gray where you can do some stuff, but it's not exactly written that you can't do it. So that's one of the things is locating where you want to practice. Try not to be in a saturated area, and it'll work out better, especially if you have a good business sense, because I know in Florida, we're getting to the point, if you go to Sarasota where my school is, or like certain points in like city of Tampa, you can throw a rock and you'll hit like, 2 or 3 offices. I know places that's way worse. California, you can throw one, there's like 20 around the block.
Yeah, we have like the highest percentage per capita of acupuncturists in the entire country. There's almost more acupuncturists in the state of California than the rest of the country combined. Not quite, but almost. There's like 44% of all the acupuncturists in the country are right here in this state. And so the other thing that I would tell people is, when you're starting your practice, remember to think outside the box. My practice is unique in that I'm mobile. I don't have a clinic at all. There's no brick and mortar that you can come see in order to see me. I 100% come to your home, and that gives me the freedom of being able to focus all my time and energy and chi, so to speak, on one client or one set of clients at one point in time. There's no door to answer. There's no secretary to mind. There's no phone to pick up other than my cell phone. And so I tell people, don't call me, but don't call me. I'm not going to answer you. Like, send me a text message and I'll get to you faster that way. Right. But be ready and willing and able to think outside of the box when it comes in terms of practice. It doesn't have to be a brick and mortar. It doesn't have to be a traditional brick and mortar. You can do things like mobile. You can work in a hospital. You can work in an integrative clinic. You can work on cruise ships. You can have destination acupuncture retreats. I've totally seen those, and I want in on that. I want acupuncture destination retreats going out to Cuba and Brazil. Like, we're going to go hang out here for a week, and I'm going to pin you every day. And we're going to have margaritas afterwards on the beach while going to go horseback riding, right? Definitely think outside of the box when it comes to your practice, because this medicine really requires needles. And that's really it. And once you have those needles in hand and you know what to do with them, the world is your oyster, and you can specialize in anything. It doesn't have to be women's health. It doesn't have to be pain. It doesn't have to be sports medicine. There are people who specialize in ophthalmology. That's medicine of the eyes. And that you can stick needles in your eyes. No, you cannot stick them in mine, in spite of the fact that I'm going blind. Right? There are people who specialize in autoimmune disorders. There are people who specialize in GI disorders. There are people who specialize in oncology. There are people who specialize in peds. So definitely think outside of the box when it comes in terms of practice. And like, there are just comments and comments and comments rolling, but at some point in time, I have to feed my 9-year-old. So thank you. Sorry, Instagram, y'all are gonna have to catch the recording of this. If you signed up for it, I will send you a copy of the recording. We will be here next week. Next week is 5:30 is our start time, because I'm teaching a class next week, and I couldn't seem to figure out the co-hosting business part of it. And we're going to have one of the original grandfathers of acupuncture here in this country, Dr. Tolbert Smalls, will be joining us, and we'll be able to see his slides. And they do include some slides from China. So please come back and join us, Dr. Lynn McPherson. I want to thank you so very much for coming on and letting us all pick your brain and take a look at your pictures and learn so much from you. I guess I'm going to go open up those emails from Michael Cornito. There's so many of them. I pay for it every month, and every month I'm like, okay, I'm going to find the time. I'm going to find the time, find the time. And I have yet to find the time, but I will make sure that I do that. Thank you, Facebook, for joining us. I'm sorry if I missed your questions. Dr. Lynn McPherson is available. You can hunt him down on Facebook as well as on Instagram. And it looks like the Facebook is just completely frozen. Thank you guys for coming to join us. The recordings will be out. The recording is available on everyone's place. I'm sure that Dr. Lynn McPherson will get a copy of it and post it, and you'll be able to see this over and over again. Thank you, Mama Shonda, for participating, and for everyone else who came out this evening. You guys have been wonderful. If you will hold on, Dr. McPherson, before you hang up, you guys all, everybody else, have a wonderful evening.
Good night, everyone.
All right, we're gonna stop the live. Wait a minute. Stop recording. Yes. And stop Facebook Live.